So you're on TRT and things are going great. Then all of a sudden you're told to donate blood. And now you're walking around feeling like crap for months, wondering what the hell just happened. I'm Mike. I run Men's Healthspan where we fix hormones and metabolic health. And I see this all the time. Guys crashing their iron from bloodletting advice that just doesn't make any sense. Unless it's $17.99 still and your doctor is your barber. All right, let's talk about ferritin and how guys on TRT are getting absolutely wrecked by this awful advice. Because here's what's happening. A lot of guys on testosterone, they're told by their healthcare providers, your hemoglobin is high, your hematocrit is high, you need to donate blood. And that recommendation is almost always completely unnecessary. But what's worse is what nobody tells you, what that donation is actually doing to your ferritin or your iron storage. I've had patients come to me and they have ferritin levels of 3 or 4. That's not low, that's destroyed. Hemoglobin and hematocrit both bounce back quickly after donation. Ferritin does not. You can feel like garbage for months. I've seen guys take a year to get back to feeling good again. And they're confused, but my doctor told me to donate. Right, and no one checked your ferritin before or after. So what does low ferritin actually feel like? It could look like fatigue, brain fog, cold hands and feet, poor recovery from training, anxiety, low mood, restlessness, restless legs, hair loss, poor cognition. And if it progresses and gets even worse, you could look at things as bad as palpitations, dizziness, shortness of breath, syncopal or near syncopal episodes. That means where you're passing out or nearly passing out. Most people and most medical providers miss this because it doesn't show up on a basic lab panel, but it does if you get an iron panel and check your ferritin. And what's crazy is this isn't some secret or some fringe hippie interweb hypothesis. The physiology in this is crystal clear. We actually see the opposite of people who get chronic blood transfusions instead of giving blood, like we see in leukemia patients. They don't tank their ferritin, they actually get overloaded. Iron climbs too high, and that creates a whole different set of problems. But now here's what really frustrates me. You go donate blood, the nice Red Cross folks check you in, they do a screening with a finger stick or light probe, and they say, your iron looks great. Well, actually, no, it doesn't. They're not checking your iron, they're checking hemoglobin. Hemoglobin is not ferritin. It's not serum iron. That finger stick tells you nothing about your iron stores. And yet I've had multiple patients say, but they told me at the blood donation site that my iron was fine. No, your hemoglobin was fine. They never looked at your iron. They never checked your ferritin. And now you're wiped out and no one can tell you why. But this has even happened to me. I don't donate frequently, but on more than one occasion when I have gone in, the tech told me my iron looks great. I didn't correct them. Didn't want to be that guy. But I'm sitting there thinking, you're not even checking iron. And how many people have you said this to before me? Here's what people don't realize. When you donate a unit of blood, you lose about 200 to 250 milligrams of elemental iron. That iron is stored in your red blood cells and it comes out with the blood. Your hemoglobin rebounds quickly because your body expands plasma volume and ramps up red cell production using stored iron to get the job done. But your ferritin, which is your actual iron reserve, doesn't bounce back nearly as fast. Iron absorption from the gut is very limited. Even in ideal conditions, most people only absorb about 1 to 2 milligrams of iron per day. So if you just lost 250 milligrams, do the math on that. That's months of recovery. Randomized clinical trials and blood donor studies show that even 6 months after donating blood, most people still haven't rebuilt their ferritin levels unless they're supplementing. And here's the kicker. This problem compounds with each additional donation. Donate again before your stores are fully replenished and you're stacking depletion on top of depletion. Probably not a huge deal if you're healthy, have normal ferritin, and only donate occasionally. But like we already covered, you're probably not checking your ferritin, so how would you know? And remember, the way all this works, people who get chronic blood transfusions, like we mentioned earlier, getting blood instead of giving blood, the only way to truly know your iron status is to check a serum ferritin with a blood test. And by blood test, I don't mean a CBC or a complete blood count. I don't mean a finger poke when they're screening you at the blood donation place. I don't mean using a light scanner. Not a CBC or a complete blood count. Not a finger stick. Not a light scanner. A normal CBC does not rule out iron deficiency, even though you hear all the time people say, I'm not anemic, my blood looks fine. But most people never get ferritin checked. A lot of doctors don't even think to check it on their symptomatic patients. And this isn't just happening to hormone replacement therapy patients. I see it in the general population too. Folks trying to be good citizens, donate blood, completely unaware of the risks. But the part that really makes me crazy, I see elderly patients donating blood at community events, their church, some club, some feel-good blood drive they heard about on the face pages. I've got one patient who donated every 3 to 4 months for over 20 years. This guy came to me with fatigue, lightheadedness, shortness of breath, brain fog. I checked his ferritin. It was 3. I know people are just trying to do the right thing. They want to help. But some of these folks should probably be getting a unit of blood instead of donating one. And so they walk away thinking they did a good deed, feeling great about it. Meanwhile, they feel like hell for months or even years, and no one checks the damn ferritin. It's dangerous, and no one's talking about it. So here's the takeaway. If you're on TRT and being told to donate blood to lower your hematocrit, stop right there. That advice is outdated, and it's usually wrong. And if you do end up donating blood to be a good Samaritan because you want to do the nice thing, not because it's for your health, always check your ferritin. Don't trust that finger stick that they do. Don't assume that when they tell you your iron looks good, that means anything. And another thing, please don't blame the blood donation phlebotomist. They're probably just repeating what someone else told them in their training. Well-meaning, but just wrong. Like anything else in medicine or in life, listen, but verify. Your energy, focus, strength, and overall quality of life can tank when ferritin crashes, and it doesn't bounce back overnight. It can take months to fix. It deserves more attention than it gets. I see this all the time in my practice. Folks think they're being proactive, they're listening to their healthcare providers, or even worse, some crazy crap they heard on TikTok, but nobody's explaining what's really happening with iron. Then they're tired, foggy, anxious, and they think, well, that's just life. It's not. It's ferritin, and it's fixable if you check it.